All right. Good morning, good afternoon, and good evening. Thank you so much for joining us today for our webinar, Critical Intersections and Practical Interventions, Reproductive Health, Nutrition, and Anemia. We can go to the next slide on delay. And on behalf of the Reproductive Health Supplies Coalition, Results for Development, and Lucky Iron Life, we are very excited to bring to you a webinar today that will cut across a range of different reproductive health issues, including family planning, maternal health, and menstrual health, and also looking at intersections with nutrition and
I think Sarah might have dropped, but I'll just go ahead and try and cover for her while she reconnects. So yes, thank you very much for joining us today on the webinar on critical intersections and practical interventions, reproductive health, nutrition, and anemia. We're really thrilled to have you with us. We're thinking that we're going to have a very insightful conversation today. My name is Lisa Rogers. I'm working with the World Health Organization. I'm a technical officer in the Department of Nutrition and Food Safety, but I also lead a group with UNICEF on accelerating anemia actions with the Anemia Action Alliance. So we bring together different partners to discuss different issues around anemia. So I'm really happy to be here with you today. We're joined by an exceptional panel of experts whose work spans research, innovation, and advocacy, each bringing a really unique lens to the intersection of reproductive health, nutrition, and anemia. So what I'd like to do first is just introduce the panel, and then we will have a few words from them. So first we have Emily Hoppes. She's a technical advisor at FHI 360. She's leading some of the global efforts to integrate family planning and menstrual health. She brings deep expertise in research, utilization, and she heads up a community of practice that's focused on contraceptive-induced menstrual changes. So really happy to have Emily with us. Next is Stephanie Chung. She's an associate scientist with FHI 360. She's working with the Contraceptive Research Development and Introduction team. She's working on improving how we measure menstrual changes linked to contraception. And her doctoral research was really important at UNC Chapel Hill, which explored medical reasons behind some of the contraceptive method denial. We're also joined by Bhavya Gowda. She's a senior director of the market shaping practice at RFD. She's overseeing a diverse portfolio of maternal health and nutrition projects, using market-based solutions to drive access and equity. So welcome, Bhavya. And then from Switzerland, we have Laura Hackel. She holds a PhD in human nutrition, and her career has been spanning USAID, IAEA, and Nestle Research. She's now at the University of Bern. She's fostering interdisciplinary action and collaboration in women and digital health, and she co-leads a startup focused on sustainable plant-based foods. So we're really happy to have Laura. And then last but not least, we're honored to have Maria Castellanos. She's a nutrition specialist at CARE Guatemala. And Maria is leading integrated initiatives to improve health and nutrition for marginalized populations with extensive experience in addressing anemia and malnutrition across Central America. So as you can see, this panel is bringing together quite a rich diverse perspectives from policy and program design to community engagement and innovation. So we're really lucky, and thank you to all the panel members for joining us today as well. I just wanted to take a few minutes or basically a minute to think about anemia. And anemia in women of reproductive age and adolescent girls is really a public health problem that we've been trying to tackle for many years now. It's one of the global nutrition targets that the World Health Assembly has, and it's an indicator for the Sustainable Development Goals. But this is a target that hasn't been able to move much in the last decade. And we've come together with partners of the Anemia Action Alliance to really dig into this issue. And we know that it's not just a nutrition issue. It's deeply intertwined with reproductive health, with family planning, and the broader social and structural determinants. So today what we want to do is we want to explore these interactions that are shaping both the risks and the solutions for tackling anemia. Our speakers are here today to share some practical insights and emerging strategies that are helping to close some of the gaps that we have in access, equity, and outcomes related to health and nutrition. Today, what we'll do is we'll begin with some brief insights from each speaker to help us understand how these issues are all intersecting with one another in practice. And first, I think what we'll do is we'll start with the intersection of family planning and menstrual health, which is an area that's often overlooked in anemia discussions, but it's really critical for both understanding some of the causes and solutions. So what I'd like to do is first turn over to Emily for her reflections, and then Stephanie will join as well. Thank you very much for highlighting how menstrual health and contraception intersects with anemia risk management.
Thanks so much. So if you could go to the slide, thank you. So when it comes to the intersections between iron deficiency, anemia, and menstrual health and family planning, we wanted to highlight two main challenges. The first is the issue of heavy menstrual bleeding, which is excessive bleeding that interferes with your everyday life. And this kind of bleeding can lead to anemia. And then related to family planning are the impacts of pregnancy and childbirth on anemia outcomes, which I think you'll hear about a little bit more later. But these two effects are cumulative and they have really significant impacts on quality of life. Both heavy menstrual bleeding and anemia can have very adverse impacts on quality of life. Stephanie?
Yes, so we know that we want to intervene in this situation, right? We want accurate and timely diagnosis, both of heavy menstrual bleeding and anemia. And this is so we can simultaneously manage both of these issues. On the nutrition side, which I think, again, you'll hear more about later, we can try to replenish iron with diet and supplements. But when it comes to heavy menstrual bleeding or the cumulative effects of pregnancy and childbirth, we have another intervention, and that's use of hormonal contraceptives. So certain hormonal contraceptives can reduce the amount of menstrual bleeding that women experience during their cycles, and also can extend the length of time between pregnancies. And as a simultaneous component of that, we also want to do advocacy and stigma reduction around the use of hormonal contraceptives.
So the barriers when it comes to this issue are normalization of heavy menstrual bleeding and anemia symptoms. So in many contexts for women, it's normalized to have any type of period, one that's painful, one that's very heavy, and people don't always know what is normal for menstruation or typical. And some of the symptoms of anemia are also normalized, especially fatigue. There's also very limited understanding, research, and treatment options for heavy menstrual bleeding and understanding of the connections between heavy menstrual bleeding and family planning. And there's a lack of guidance on contraceptive use for heavy menstrual bleeding, especially when it comes to low and middle income country contexts.
Great. Thank you both so much. This is really helpful. And I think this is something that even within the work that WHO is doing in the Anemia Action Alliance, this is something that comes up time and time again, and that lack of guidance. So thank you for highlighting this and how we might be able to think going forward on some of the integrated approaches. Let's now shift to the maternal health lens. Bhavya, could you share your perspectives?
Yeah, thanks so much, Lisa, and thanks, Emily and Stephanie, for teeing things up. So I'm here to talk about the intersection between anemia and maternal health. And as Emily alluded to previously, anemia is linked with adverse pregnancy outcomes for both mothers and their newborns. From the perspective of the newborn, anemia increases risk of low birth weight, small gestational age, preterm birth, as well as instances of stillbirth. And on the side of the mother, anemia is associated and affiliated with increased risk of postpartum hemorrhage, as well as maternal death. Fortunately, despite these grim problems that I've just highlighted, there is a suite of effective products for both prevention and treatment of anemia within the context of maternal health. On the prevention side, we have both MMS, which is multiple micronutrient supplements, as well as IFA, iron folic acid. It is standard in most countries to provide IFA as antenatal care supplements to be taken daily throughout a woman's pregnancy. Additionally, MMS, and I would say specifically Unimap MMS, is a more cost-effective alternative to IFA, and the Unimap formulation has the right combination of micronutrients and supplements in order to ensure that there's a greater impact on decreasing the risk of adverse pregnancy and birth-related outcomes. And on the treatment side, we have iron tablets, so that's things like iron, like ferrous sulfate or IFA. Those are the most commonly and most widely available forms of treatment for anemia. And then on the IV iron side, there is iron sucrose as well as ferric carboxymaltose, or FCM, it's a mouthful, which is used to treat moderate to severe anemia. So even though we have some of these prevention and treatment tools in our toolkit, there are barriers to access to some of these commodities. So for newer or emerging products like MMS and IV iron, some of the issues that are associated with access include that there's a limited supply base. There's not as many manufacturers who are making some of these products, particularly in LMICs. And some of these products are also highly dependent on donors providing a lot of the funding for some of the products. And we aren't seeing as many governments that are directly purchasing some of these newer products. They're also associated with higher prices relative to the established products, and there's lower demand due to price, lack of awareness, or lack of clear treatment guidelines as well. And on the established product side related to iron folic acid and iron tablets, those products are more affordable and more widely available. However, there are some concerns related to inconsistent government financing, quality of the products, and general procurement inefficiencies that we often see at the country level. I would say despite some of these barriers, I think that there are interventions and market shaping interventions that could be deployed in order to increase access to some of these life-saving products. Lisa, back over to you.
Great. Thank you, Bhavya. And this is a really powerful reminder of just, how things are advancing in this area and how important the maternal nutrition is for those health outcomes. We know that there's more commodities available, but like you say, how do we make sure that they're accessible to the right people at the right time and with the quality products? So we really look forward to digging into that a little bit more and progressing on that. Finally, let's hear from the nutrition side. Laura, over to you.
Thank you so much, Lisa, and thanks for the colleagues also who have already framed the problem. So I won't dig further into that, but there are interventions, they exist and they also work. So from the nutrition side, there are what we call food-based approaches. So for example, it's to increase the dietary diversity, which is probably like the most desired effect, but it's not always very easy to implement practically, especially for low resource populations. And then another approach is to decrease absorption inhibitors. So biochemically, there are some substances that would interfere with nutrient absorption, but there are some food-based strategies such as germination or soaking of, for example, cereals that would decrease those absorption inhibitors. And then there is food fortification, and that can be done either for the mass population or for targeted population groups, such as, for example, fortified infant cereals. And then there is biofortification, which basically works similar to the regular food fortification, but the plant does all the work. However, those fortification amounts are usually lower than with conventional food fortification. And then there are other approaches that are not strictly nutrition-based, that include supplements or also sprinkles where you would put micronutrient powder on your food. So like I said, the interventions exist, they sound very good, but there are some barriers to accessing these interventions. And the main barriers are related to availability, accessibility, and affordability. So you can pick any or all of those for populations in low-income countries, for example. And then another issue is that the solutions have to be culturally appropriate. So, for example, if a population consumes mainly maize, fortified wheat flour wouldn't probably have much impact, because if the population doesn't consume it, or if it's not properly integrated into their diet, it will be very difficult to change their approaches. And then one important aspect is also that the food within a family, let's say, may also be distributed differently. So if you, there are some gender-based sensitivities to this as well. And then one big issue that many of us are familiar with is also the issue of climate change. And that doesn't only impact the individuals in terms of their livelihoods, but also it can impact the nutrient density of certain foods, which then also decreases the nutrient intake from these foods. And particularly for populations in low resource settings, there is also a lack of awareness, and those individuals also have to prioritize and juggle a lot of different things. So they may not have the knowledge or the bandwidth to focus on dietary strategies and how to improve them. So with that, I will hand it back over to Lisa. Thank you.
Thank you, Laura. It's a really important reminder of how important diet is and how to get the nutritious foods within that diet, but also recognizing that it's not possible all over the world, and we have to supplement, and fortification is a pretty powerful intervention. We also have to think about how climate is affecting all of our food supply as well. So those are really great reminders. And so some of these foundational insights, I think, are helpful as we move into the next phase of a discussion among the panel members to explore how these different sectors can work together more effectively, and what practical interventions are showing promise across the context. So what I'd like to do is begin by exploring how we can harmonize some of our efforts across nutrition, maternal health, and reproductive health to build more cohesive approaches to anemia prevention and treatment. And I think about some of the work that has been done by exemplars in global health that have really showing the power of contraception, nutrition, antenatal care services that have been really shown to be positive contributors to anemia reduction. So I think building on some of these things would be really great. And I'd like Emily to maybe kick us off, if she could speak to us about how efforts to integrate family planning and menstrual health are evolving, and how nutrition kind of fits into this picture as well.
Thanks so much, Lisa, for that question. I think it's a really important one to think about. And integration and harmonization is something I've been thinking a lot about over the past 5 years, and especially when it comes to integrating family planning and menstrual health. And I've specifically been focusing on how contraceptives change the menstrual cycle, and how we can sort of leverage that to help manage menstrual disorders like heavy menstrual bleeding. And through that work of focusing on heavy menstrual bleeding and contraceptives, we were sort of brought to the issue of anemia because of the connection between heavy menstrual bleeding and anemia. And I just say the most important thing that comes to mind when it comes to harmonization and integration, it's just essential to bring people together and create opportunities and spaces where people can sort of break out of their silos and talk to each other. And we've seen a lot of success in doing that through a community of practice that you mentioned at the beginning of the webinar. So we've created a community of practice around this issue of contraceptive-induced menstrual changes that brings together people from menstrual health and family planning. And when you bring people together, you kind of discover that they've everybody's been thinking about the same thing, but they haven't been talking to each other about it, and they haven't been bringing their specific expertise to one another. So it's really helpful to come together. And through this group, we've been able to do a number of consultations and meetings and events, including one that was specifically focused on the role of contraception in addressing anemia. And that was a really interesting and exciting opportunity. But we didn't stop there. Just bringing people together isn't the only thing. I think it's also important to sort of raise awareness and write about what you have been doing together. And so we've done a lot of thought leadership, producing sort of knowledge products. We have a research and learning agenda around the topic. We've created programmatic guidance for integrating family planning and menstrual health. We have a counseling tool for talking to family planning clients about menstrual changes. And related to anemia, we've also put together an annotated bibliography about those connections, and Stephanie shared a DHS analysis. And then the final thing I want to say is this may seem kind of like a lot of talk and no action to a lot of people, but doing all of this collaboration and thought leadership has sort of sparked interest and attention with donors. And we've been able to sort of leverage that and get funding for research studies. And I'll put a link to one of the studies in the chat that I think is important to this discussion, which is the LISA trial. And that's looking at the effects of the hormonal IUD on iron deficiency anemia in Kenya. So it's a really interesting study. And we have other research ongoing around this topic that I'm happy to talk about and answer questions about in the chat as well. Thank you so much.
Thank you so much, Emily. And I'm wondering if maybe you could put into the chat the community of practice too, if maybe some might want to join that. That sounds really fantastic. And I think there could be a lot of power in sharing that information. Like you say, I run into people all the time who have this interest, but being able to direct them to this would be fantastic. Great. Thank you again. Bhavya, let's turn to you now. How can person-centered approaches and information sharing platforms like both the community of practice or the Anemia Action Alliance help us to coordinate a little bit more effectively in what we're trying to achieve here?
Yeah, thanks so much, Lisa. I'm really glad that you brought up the Anemia Action Alliance, which you are our fearless leader for. I think that's a really helpful platform to be able to connect the dots, especially globally, for those of us that are working across multiple geographies, to be able to share lessons learned. And this might become a bit of a broken record, but Emily already mentioned this, to break down some of the silos that we're working on. So I think being able to have that coordination and exchange platform at a global level is going to be extremely helpful, and already is under your leadership. But I think we also have to go down to a national level and consider, how do we harmonize those efforts across these areas in order to ensure that there's a real opportunity to be able to improve coordination across stakeholders at a country level that are all working in one geography. And I think that is going to require having visibility into anemia-related priorities, sharing information more openly across some of these health verticals, and I think also designing and implementing activities that intentionally bridge these areas and consider a person-centered and woman-centered approach, as opposed to treating a woman according to like each one of these silos. So maybe just to provide two tangible examples of how this works at sort of the country level, is this conversation is super live right now in the MMS space. So MMS is often sort of put in the nutrition category. It's kind of owned by the nutrition office within the Ministry of Health, but it's a product that's given to a woman during antenatal care. And so across health and nutrition programs, there's a recognition that, ANC needs to be strengthened, but we're also navigating a reality where, different programs are relying on ANC to reach women. And many countries have varying levels of ANC attendance rates as well. So there's like a lot of pressure that's on ANC programs right now to reach pregnant women. And then I think the second example that I wanted to share is from a product perspective. And so as countries are conducting supply plans and trying to think about how they want to procure and purchase products, anemia products like an MMS or iron folic acid are often not quantified in coordination with the maternal health team, which can make financial and procurement planning for the full suite of maternal health products a little less effective. So I know that I've cited these two sort of country level experiences where things haven't necessarily been working well, but I do think that there is an opportunity to sort of create greater linkages and points of intersection between nutrition and maternal health programs in particular. And I think that is also layered on to some of these global level platforms that can help sort of tie in that coordination across organizations that are working across these areas at a more regional or global level. So thank you so much, Lisa. Back over to you.
That's fantastic. Yeah, that's really fantastic. I really like those that emphasis on the collaboration, that emphasis in getting down to the country level. And I think that's exactly where all of us need to be working and promoting that, and not putting too much on ANC, because yes, we all want ANC to to take on much more, but we have to recognize that. So thank you all. And I think that brings up a lot of the barriers. So I want to talk a little bit more about what's getting in the way of integrating anemia interventions across sectors. We know, yes, there's a lot of interventions. How do we not overload one? How can we ensure that we're right sized? And what do you think are some promising strategies that are emerging to overcome some of these barriers? So I'd like to start with you, Laura. What are some of the biggest challenges from the nutrition perspective?
I think the challenges are very similar across the different domains, I believe, because we have a lot of evidence. I think sometimes the context may be limited. So as Pavia mentioned earlier, there are maybe some regional differences, and if you would kind of go a bit more granular on the local levels, the issues may be different, or the reasons for anemia may differ as well. I think, we have interventions that work, but sometimes they may not be culturally appropriate, for example. And I think what we really need is to have good data that are shared with those who need them to actually act on the different levers to make it work. And as the others have already highlighted, I think collaboration is key. It won't work without collaboration, but we need to kind of speak different languages to make sure that this collaboration can happen, because for someone who's been working in the field of nutrition for over a decade now, it's clear that nutrition is very important. But if there is a minister somewhere who's looking at different things, and maybe nutrition is not on their radar, this has to maybe be conveyed a bit differently. And I think the communication part is also very important. And then, this will trickle down into the legislation, and then also not just the legislation, but also the enforcement of, for example, fortification policies.
Great. Yeah, thanks, Laura. And like you say, I think we all face similar challenges. So that also brings the question of collaboration, and let's figure this out together. Let's try to harmonize so that we don't continue to reinvent wheels and things like that. So I appreciate those perspectives. Just want to focus a little on the implementation perspective too, and I'd like to turn to Maria and ask for her experience in working directly with communities. What are the most pressing gaps in how we currently address anemia, and are there any innovations that have been particularly helpful? So I think Maria will be speaking in Spanish. So if everybody wants to go to the Wordly app that was posted into the chat, there will be a translation there for Maria. Go ahead, Maria.
Gracias, Lisa. En Guatemala, las brechas de micronutrientes son elevadas. La problemática no se aborda de una manera integral, y esto es también debido a las condiciones de pobreza. Alrededor del 70% de las familias padecen de pobreza o pobreza extrema. Esto impacta directamente en la poca diversidad dietética que se mencionó anteriormente. Entonces, el conjunto de factores logran que haya una dieta poco diversa, y en CARE hemos identificado que la educación y la sensibilización acompañadas de suplementos son escasas. Es importante brindar este acompañamiento, ya que muchas familias aún no logran relacionar la anemia con síntomas o con riesgos. La suplementación existe, como lo han mencionado. Sin embargo, sin el acompañamiento constante ni las estrategias educativas, esto reduce la efectividad del suplemento. Karen responde a estas deficiencias con una estrategia integral que combina el fortalecimiento de conocimientos, el acompañamiento durante la suplementación y la innovación en educación alimentaria y nutricional. Muy importante también involucrar el acompañamiento comunitario. Dentro de las innovaciones útiles que hemos identificado también es la recuperación de los cultivos ancestrales como estrategia de seguridad alimentaria y nutricional sostenible, accesible, la fortificación de los alimentos a nivel familiar. Lo hacemos de la mano con Lucky Iron Leaf, siempre acompañados de la formación adaptada al contexto local. Podrán ver ustedes algunas fotografías de cómo realizamos las réplicas de lideresas comunitarias que participan, adoptan y replican el conocimiento en las niñas, mujeres y en sus familias. Promoción de huertos familiares, huertos escolares que promueven el consumo de alimentos ricos en hierro, en vitamina C. Nos enfocamos en maximizar la absorción y también nos enfocamos en el cambio social y de comportamiento. Promovemos del huerto a la mesa, que comer sano es accesible y es posible. Y CARE integra la voz de mujeres y familias en cada paso de la estrategia, construyendo soluciones culturalmente relevantes y sostenibles. Hemos tenido experiencias especialmente con escuelas. CARE actualmente trabaja con más de 10,000 niñas y niños en escuelas públicas de zonas vulnerables y el modelo incluye capacitación a los docentes y padres como agentes de cambio, huertos escolares bajo la metodología Aprender Haciendo, acceso a agua segura, que sabemos que es un componente muy importante para la absorción, distribución de alimentos fortificados. CARE lleva esta estrategia integral a las escuelas, conectando educación, nutrición y participación. Muchas gracias, Lisa.
Thank you, Maria. That is such a wonderful example of meeting people where they are and really understanding the situation that they're in, supporting their livelihoods, supporting the traditional diets, and really understanding and how to maximize that for the health and nutrition, the gardens. And that's just a really a powerful, and the pictures were really telling the story. Thank you very much for sharing those. I really appreciate that. So that's, building on, how we explore, the implementation side, how do we explore how funding and policies can better support integrated solutions? Stephanie, maybe you could start us off with your reflections on how current funding priorities shape what's possible.
Absolutely. So I'm coming at this from the family planning perspective. And in the family planning field, for a long time, we've been grappling with this long legacy of the goal of family planning programs and the reason why they're being funded being to reduce fertility, right? Especially lowering total fertility rates in the global south, lowering the number of children each woman has. And in recent years, there's been a big push to realign those priorities and make it more about what individuals desire about themselves and their family formations and their access to different family planning methods. And this is where we really have an opportunity to highlight the non-contraceptive benefits of contraception. So especially with the Gates Foundation, we've had a lot of success talking to donors about funding projects looking at these non-contraceptive benefits, things like addressing anemia. And so when donors and governments are more on board with a more person-centered approach to family planning programming, that's when we can really try to highlight things like family planning being beneficial to anemia prevention. And so, of course, when that gets down to policy, it gets a little bit more complicated, or when it gets down to the individual patient and provider interactions, that can become a little bit more complicated. We've done some recent research in Kenya looking about how much time providers were spending with family planning patients, especially first-time family planning patients, when they're communicating this information about family planning. Are they giving out enough information. And we were really finding, no, they weren't. Often we sent in mystery clients to see how long providers were spending educating patients on their family planning options. And often they were only spending 2 to 5 minutes per patient. And that really isn't enough time to, tell people about the various different methods and how not only it can impact their fertility, but also, potential other things that they might be looking at, like how it might have an impact on their menstrual bleeding or other, side effects of the contraception. So when we're looking at policy priorities and funding, I think we do want to put some money and some policy efforts toward making sure that providers have the information that they need in order to communicate with their patients, not just about how contraception can impact fertility, but also how it could impact, for example, anemia, and have these, synergies across nutrition, maternal health, and family planning services.
That's a great example, and it's really nice to hear, how these interventions have, broader impacts than what we might initially be thinking. And it's good to hear that there is funding for that. Maria, I wanted to come back to you to see how you see some of the disconnects between global guidance and what's happening on the ground.
Gracias, Lisa. Algunas de las más importantes que hemos identificado es que aún persisten problemas en las cadenas de suministro. Hay comunidades muy alejadas, entonces difiere la cantidad que yo proyecto y que yo necesito con la temporalidad en la que el producto se encuentra disponible. La adherencia al consumo sigue siendo baja, pero la relacionamos mucho con que se coloca en un segundo plano. En un primer plano tenemos necesidades básicas insatisfechas, entonces la suplementación entra en un segundo plano. Consideramos que con el acompañamiento y con la inversión en las necesidades básicas, la suplementación va a tomar el papel necesario y la importancia necesaria en la vida de las niñas, mujeres y sus familias. La falta de monitoreo cercano para brindar este seguimiento. Conocemos diversas maneras de la suplementación, pero en CARE transformamos estas brechas en oportunidades, fortaleciendo estrategias integrales, involucrando a alianzas multisectoriales, estratégicas, locales, de gobierno y de cooperación para ir hacia un mismo objetivo. Consideramos que la fortaleza de identificar estas brechas es justamente la organización y la respuesta a corto plazo. No requiere en ocasiones de aumentar los tiempos para que llegue a la suplementación, porque las niñas, las mujeres en edad fértil, las madres y toda la familia están latentes de llegar y de reducir esa brecha en el consumo de micronutrientes. Nos están esperando esta respuesta. Si nos podemos unir para brindarlo y llegar al mismo objetivo, creo que vamos a reducir las brechas entre las directrices globales y la práctica, como lo podemos observar en estas fotografías. La participación es constante, la sed de los conocimientos también está presente. Entonces, contextualizar el conocimiento, llegar a donde tenemos que llegar con el mensaje, va a permitir que estas brechas se reduzcan.
Thank you, Maria. That is music to my ears. How do we reach the women? How do we follow them? How do we make sure that what we're providing them actually is working for them? And how do we make sure that they're well taken care of in a collective manner? Very, very important that we do that. So with these critical insights, and before we open it up to a general question and answer session, I'd like to ask each of the panel speakers to reflect on the future. In 1 minute each, it's going to be challenging. If we came back together in 5 years from now, let's say, what progress would you hope to see? And what steps do you think we need to take to get there? Laura, let's start with you.
Yes, thank you very much, Lisa. I'll try to be quick. So I think what everyone has mentioned and what would be the best solution is to collaborate. I think none of the approaches that were mentioned will be successful in isolation, but it really needs this cohesive approach of different sectors working together and kind of looking into the evidence of, okay, what are the reasons for anemia in a specific population, in a specific region, and what are the solutions that already exist, and what's still missing. So I think if we kind of combine the different solutions together in a smart way, this would be the ideal. And I hope with, you know, also novel tools, with novel technologies, it makes it slightly easier to do this, but it will still require the humans to come together to identify priorities, see what has worked maybe in a different sector, and how can we adapt it and implement it in across the sectors.
Great. Thank you so much, Laura. Bhavya.
Thank you. Great response, Laura. In 5 years, something that I'd really love to be able to see is real declines in anemia rates and related complications. And from the maternal health perspective, that's fewer adverse birth outcomes, fewer cases of postpartum hemorrhage, and fewer maternal deaths. So that's sort of the big picture vision. But I think more specifically, I would really love to hear us talking about a handful of country exemplars that have taken intentional steps around coordination, like Laura, you just spoke about, that have, you know, coordinated across these different silos in order to take a more holistic health systems approach, as well as a person-centered and woman-centered approach in order to implement, you know, the anemia continuum of care across some of these programs. And I think, you know, over the next 1 to 2 years, there's going to be critical things related to financing that's going to be super important, and government resources. And the second thing that I would also say is around demand and generating enough awareness across decision makers, providers, as well as women, to be able to have access to some of these services and products. So that's my hopes and dreams for what we'd potentially see in the next 5 years.
Sounds great. I love it. Stephanie.
Thank you. So for this question, I'm thinking about it kind of at the individual level a bit. In the next 5 years, I would love it if more women and girls knew that hormonal contraceptives could be used to treat anemia, and they were aware of anemia symptoms and aware that they could ask for anemia testing, and that they had the solution that might help meet needs in various areas of their life, for their family planning needs, for their anemia prevention and treatment needs, and also, you know, using contraception for other non-contraceptive benefits like reducing menstrual pain or addressing acne, or the wide constellation of things that contraception can address. And so I think when I'm looking toward the future, I would like to make sure that both patients and providers know about this potential solution and potential treatment, and have the information and data they need to have good conversations about it, so that people can decide on what option would be best suited for their lifestyle and their needs.
Great. I look forward to that happening. Emily.
Thanks. So obviously mine is very much related to Stephanie, but I'm going to focus on a larger level and hope for more research and resources going into understanding menstrual disorders like fibroids and heavy menstrual bleeding, especially in low and middle income countries. And ideally, this would happen by both the menstrual health field and the nutrition field championing this together. So I don't think it's been a focus of the menstrual health field, and it's not been a focus of the nutrition field. So if we can kind of come together and push for those resources and more research, that would be ideal for the next 5 years. Thank you.
We can do that. Yes, we can do that. Looking forward to it. Maria.
En CARE creemos que la clave para enfrentar la anemia no son acciones aisladas como lo hemos podido observar en este panel tan enriquecedor, sino que depende de una estrategia integral que articule educación, nutrición, salud, investigación, agricultura y liderazgo comunitario. Trabajamos para comunidades empoderadas. Esperamos en 5 años, primero, aumentar las inversiones para consolidar esta estrategia integral con sistemas sólidos que respalden la sostenibilidad de las acciones. Segundo, fortalecer la educación comunitaria en idioma materno, con mensajes claros, pero de una manera entendible para que la educación tenga impacto real. Tercero, poner a las mujeres y niñas en el centro, porque cuando ellas fortalecen sus capacidades y liderazgo, la nutrición de sus familias y sus comunidades mejora. Consideramos en CARE que esto solamente es posible al abordarlo de una manera integral.
Great.
Gracias, Lisa.
Thank you to all the panelists. You are incredible, and I really look forward to all the work that's going to happen in the next 5 years. And I can say that each of you have spoken about some area within the comprehensive framework for action to accelerate anemia reduction. So I think everyone's on the right path, and it's just how do we come together? How do we forge ahead in a more aligned way so that we can make more of the impact that we all desire? So really appreciate all the panel speakers here. We're going to move into a question and answer session. Sarah is going to lead it for us. She's been monitoring some of the questions and answers coming through the chat there. And so let's see what we have going so far. And over to you, Sarah.
Awesome. Thank you so much, Lisa. So there's a couple questions that came in through the chat, and then if other people have questions, please do continue to put those in the chat as well. We've got a bit of time with our speakers. So one of the first questions that came in was a question around the extent to which iron products or supplements are subsidized and kind of the role that subsidy might play in accelerating access to these products or in making them more available in different markets. And then sort of a second question to that is thinking about what the markets look like for iron supplements in different countries and to what extent those markets are segmented. So if there's variation in the level of subsidy, kind of different approaches around donation or selling these products. And so Laura, I'm going to open it up to you first if you have thoughts on this question, but would certainly invite our other panelists to speak to it as well. So Laura, perhaps I'll hand to you first and then we can invite others to chime in.
Yes, thanks so much, Sarah. And I think in terms of success stories that we have, I think there are many, and they all really, I would say, have this collaborative effort. In terms of subsidies, this would kind of differ, I guess, from region to region or country to country. I think India would be a really good successful example for kind of trying to tackle the anemia challenge. I know that there is a very recent publication in the Lancet that talks about the Anemia Mubarak initiative. And again, in terms of subsidies, it really depends. I think there used to be a lot of efforts from different organizations that would, for example, provide subsidized fortified foods, also in non-emergency contexts. But I think with the kind of global donor situation changing, I think a lot of those efforts are unfortunately on hold for the moment.
Yeah, thank you so much, Laura. I'm also wondering, Maria, you might have some thoughts on this as well from that implementation perspective. So wondering in Guatemala and in the programs that CARE is working on, are the iron products that you're working with often subsidized, or is there a different way that you're creating that access for local populations?
Gracias. Actualmente estamos trabajando con Iron Leaf a través de la suplementación a nivel familiar con la hoja de hierro. Creemos fielmente que la educación y el acompañamiento hacen que la familia adopte dentro de sus prácticas diarias la suplementación. Un buen acompañamiento, una sensibilización adecuada hacen que la estrategia sea funcional. El tiempo de vida que tenemos es elevado y lo practican de manera diaria. Entonces consideramos que esta estrategia ha sido bastante funcional, como lo pudimos observar. Ya es parte de las buenas prácticas de alimentación que realizan y la suplementación es a nivel familiar. Hay unas fotografías muy hermosas por ahí. Entonces, estas son algunas de las buenas prácticas que nosotros como CARE Guatemala hemos adoptado. Estamos también en línea de investigación sobre suplementación de polvo de hierro. Entonces, estamos emocionadas de compartir pronto los resultados con ustedes, siempre de la mano con Iron Leaf, para ir identificando qué espacios tenemos para suplementar a niños, a niñas, mujeres en edad fértil, porque como les mencionaba, la brecha de micronutrientes en Guatemala es elevada. Entonces, una correcta suplementación va a venir a dar la respuesta adecuada ante la problemática que tenemos en el país.
Yeah, thank you so much, Maria. And then I think also I'm very happy to invite our moderator, Lisa. I imagine you also have some thoughts on this question. So Lisa, would love to turn it over to you as well.
Sure, thanks. So, and I've been reflecting on this a bit too, because one of the process indicators for how are we going to get a reduction in anemia for women is to increase iron-containing supplementation during the pregnancy period. And so we're about ready to embark on doing a collective exercise to really understand the barriers. Many have already done this, so it's us bringing together the information that's already collected both on IFA, on MMS, so IFA, the iron and folic acid containing, the multiple micronutrient supplements. And how do we help the supply chains? There's so much going on in this area, but also quality. We're really wanting to make sure that the women receiving these products get the highest quality product, because this is a very vulnerable period of time for them. And it's not easy to consume these tablets. And so how can we make it easier for them? There are donors out there who are providing these to countries. We don't know how long they're going to be able to continue doing so. And I understand R4D is doing a lot of the market shaping as well. So I think you guys are also really well positioned. And how can we come together collectively to really encourage this? And how do we make sure that these women are getting the right products during this really critical time period in life?
Awesome. Thank you so much, Lisa. Sort of the second set of questions that we had in the chat were around some country level examples of integration, particularly around anemia prevention and treatment, as well as with menstrual health and hygiene. And so some kind of different ways that people have explored that at the country level. There's already a fairly engaging conversation happening in the chat. So if you haven't seen that, definitely encourage you to check it out. But Emily shared a couple of examples of hormonal IUD research and work happening in Kenya, Malawi, and Nigeria, as well as a bit of back and forth on some of the challenges of the hormonal IUD, particularly for adolescent populations, and some opportunities to come together around better counseling, better social and behavioral change, and also looking at other hormonal contraceptives that could really create that same impact and same opportunity. Do any of our other panelists have examples of country-level integration efforts, either for menstrual health and anemia, but perhaps zooming out a little bit more broadly of trying to better tackle issues related to anemia, along with maternal health, along with family planning, along with nutrition? So I'd open it up to our other panelists if you have a thought.
Can I
Feel
just
free to jump in.
add one example that I didn't mention in the chat as we were talking? I thought about it. So in my list of resources, I provided a counseling tool called the Normal tool that can be used by family planning providers to counsel on menstrual changes. And actually in that research, we found a lot of people talking about when they go to use contraceptives, they'd like to use them to try to feel more strength, because when they have heavy bleeding, they feel tired and feel like they can't do their daily activities, which they didn't connect directly to anemia, but it sounds a lot like anemia. And so in that tool, we have a message that says, contraceptives provide the opportunity to be given some strength and freedom back in your life. And so we've scaled up the use of that tool in Kenya. And so I thought that was a very small but important example. And you can get the link to that tool and see those messages in the chat.
Awesome. Thank you so much, Emily. And seeing no further questions in the chat, I think I'm going to hand it to our final speaker to close us out, and would love to welcome Caitlin with Lucky Iron Life to leave us with some closing remarks. And then we'll be in touch with all of these wonderful materials that people have put in the chat in our follow-up. So over to you, Caitlin.
Yeah, thank you so much, Sarah. And thank you for this wonderful panel discussion. I think it's really great to see how we're kind of bringing together the various different thematic areas and breaking down those silos. I think for me, the largest reflection is, iron deficiency has been resistant to public health interventions. And the reality is, when we're talking and designing about public health silver bullet solutions don't exist. And so whatever tools we have in the toolbox, the more tools that we have, the more likely we are to meet people where they're at in their lives. And so I think Maria was the one who talked about this, really making this a person-centered, a woman-centered approach, treating her as a whole person across her whole life cycle. If we have a variety of tools in the toolbox, then we're more likely to meet her where she's at. I really think I liked the piece at the top of the webinar talking about prevention. I believe it was Bapia that talked about prevention. And I think the reason why I appreciate talking about prevention is you inherently deal with the root causes. So for example, we know that iron deficiency is a gendered issue. And so if you tackle gender inequality and the gendered reasons why a woman or a girl would be iron deficient, you inherently are then also focusing on prevention. So I really appreciate the conversation around prevention. I also think it's important to recognize that the symptoms of anemia being normalized as a barrier to treating it is also a huge problem. And I think it's a larger symptomatic issue around women's health and girls' health, and saying, well, oh, you're just tired. And so that's just normalizing it, and really advocating that women don't have to feel like this. And there are other interventions for them, and that they don't have to feel tired, or they don't have to be like that there is something else available for them. And then also, Laura, I really appreciate the piece around climate change. I think that is a really interesting and emerging piece around nutrition and iron deficiency, and how climate change is going to be impacting rates of iron deficiency and nutrition insecurity. I think really the dialogue around climate and food security is really important, but we really need to also focus on nutrition security and how that's going to be impacting and making people nutrition insecure. And nutrition insecurity should be the foundation of food security. So I think we've really touched on a lot of different pieces here. I'm very grateful. I think this is a really interesting panel discussion, and I'm really happy to see how the silos are kind of intersecting, and we're starting to break those down and talk about and really make the effort into collaborations, as we all mentioned.
Awesome. Thank you so much, Caitlin. And I just, want to echo a huge thank you to all of our incredible speakers today. A thank you to Lisa for her excellent moderation across our panel. And a thank you to all of you for coming and spending this hour with us. I think those of you that are familiar with RHSC, iron is not necessarily one of the supplies we talk about regularly, but I think our panelists today have shared excellent insights about why iron and other anemia prevention and treatment products really are part of reproductive health supplies and part of that enabling environment that secures better health outcomes for women across a variety of reproductive health issues. And so thank you all for joining us. We will collect all of these different resources in the chat and resources that our speakers sent over and share them when we circulate the recording. And please do feel free to reach out to us if we can help make any connections across this group. I think, as we heard loud and clear today, this is an issue that will take a collective action solution. So definitely encourage people to come together around this. And we are very happy to help enable different connections sort of across the spectrum. So thank you once again. We hope to see you all again soon. And thank you to our incredible speakers. Have a great rest of the day, everybody.
Thank you very much.
Thank you.